The next statistic that we're going to be learning to calculate is the inpatient bed occupancy rate. This is covered in your textbook on pages 550 to 552. The inpatient bed occupancy rate is sometimes also referred to as the percentage of occupancy, and like some of the other statistics that we've looked at, it can be used as an indicator of the financial status of the facility. And typically, if the bed occupancy rate is higher, then that's going to mean that the facility is bringing in higher revenue. In other words, more of their beds are filled, they're taking care of more patients. So in theory, they should be making more money. The inpatient bed occupancy rate can be calculated either for the entire facility or for just one specific unit or one specific area of the hospital. The official definition of an inpatient bed occupancy rate is the percentage of official beds occupied by hospital inpatients for a given period of time. Now we're going to break that definition down and see kind of what it tells us and what it means. First of all, we see that it says the percentage. So we know that the answer that we're looking for will be a percentage. We know that from the definition, but also because we're figuring a rate. And remember that rates are displayed as percentages. The next thing that we can tell from our definition is it talks about official beds, and that's not as simple as it sounds. There is a specific definition for official beds. The official beds is the number of inpatient beds that is set up and staffed for use on a given day. So the hospital bed has to be one that is ready to go. It's in an area of the hospital that's not under construction or anything like that, and it's open and there is adequate staff to take care of a patient in that bed or in that room. Okay. What else do we know from the definition? We see that it says occupied by hospital inpatients. So if you can think back when we're calculating inpatient rates, remember that that tells us that when we're doing our formula, we're going to need to multiply by 100 because inpatient rates are calculated at a per 100 rate. Okay, and the last thing it says is for a given period of time. So that just tells us that time is going to be a factor, and time is going to be something that we're going to need to pay attention to when we're calculating this rate. So just to repeat, the percentage of official